Many of you who've had healthcare services in the past have received in the mail from your insurance company a document or a form called an EOB. An EOB is short for Explanation of Benefits. For many of you, it looks foreign and you don't understand any of it. Well, we're going to try and simplify it for you today. As you see in the background is a sample EOB of a patient, John Doe. A couple things that are important on this EOB. In the back, you can see all the demographic information regarding John Doe. His policy number, his address, patient ID, and so forth. That's all pretty standard on all EOBs. However, what's important for you to know as well is number 21 and 23. So for example, 21 is your service date, when you had service performed either at the doctor's office, at the hospital, the MRI center, an outpatient clinic. That's when you had the service performed. Now, what's also important for you to know, take a close look at number 23, where they have it as service code. What that means is your CPT code. That is what the doctor or the facility billed out to the insurance company to get paid for services, or for the insurance company to pay the provider, the doctor or the hospital. So you will see in this particular EOB there are 3 codes that were billed out, and as we move through number 25, 26, 27, 28, it gives you the amount billed, the amount that was reduced from the bill due to probably contractual arrangements that the insurance company has with the provider. And then you see at the bottom, number 35 is the issued amount that they paid to the provider. And sometimes that you will see in your EOB, it will also say the amount that you may owe the provider. And so in this particular case, a total payment was made to the physician of $150, and you may get another bill possibly from that provider on services that were not covered by the insurance company. So an EOB, it means explanation of benefits. And in this particular case, where we look at number 38, your responsibility is $120.01. And so that would be your responsibility for those services. Now, the reason that you want to have your EOB is obviously not to know is to know what your provider was paid, but also what your responsibility is. But also you want to contact the insurance company to let them know that these actual services were performed. And that's why it's important where you see the service code number 23. Those are CPT codes. We mentioned that earlier. So when you call the insurance company to verify the services that were performed on you, use those codes to let the insurance company know that either this was performed on me or maybe it wasn't. So that's why you need to know the CPT codes when you call the insurance company to get verification that those services were actually performed for you. So in a nutshell, an EOB just tells you what the insurance company paid, what your responsibility is, and how you can contact the insurance company. The best thing, an EOB is not a bill, so don't be afraid of it. So when you get it in the mail, open it up. It shows you what has occurred with the services that you receive from your provider. And it's important also because if you're going to an in-network and out-of-network provider for services, you will see that difference. So an in-network provider typically will show all the discounts. And if you're going to an out-of-network provider, well, you're going to be paying most of that bill. So because you're going to an out-of-network provider. So it's important for you to get in the mail, open the EOB, look through it. Remember to look at the codes. The CPT codes are important to know what those services are, because that's why you call the insurance company to let them know what are these codes, what did I have done. So you can tell them that my EOB has these CPT codes. What are they? So when the insurance company informs you, you're aware and saying, oh yeah, I remember having that, I had that, no I didn't have that. So the EOB is an explanation of benefits of the services that you had at your provider. Remember, you do have control over your health care. Don't let the system wrap you in red tape. For more information or to subscribe, please visit